Okay. Hey Shelby, I'm Ava Marie. I'm gonna be your nurse today. I'm just gonna perform a little physical assessment head to toe. Starting off with your head, looking at your scalp and palpating your cranium just for any abnormalities, any indentions, any bulges, assessing her skin and face for symmetry and expression. Basically just looking for any abnormal expressions. Palpating her temporal arteries and palpating her temporal mandibular joint by asking her to open and close her mouth. And there is no popping present. That's good. Okay, and then we'll move on to her cranial nerve. This is just assessing whether the person can clench her teeth very well and hold against resistance. Clench your teeth well. Good. And then just assessing that cranial nerve also as running a cotton swab across your face just to assess for sensation. So, can you feel this okay?
I can.
And this side. Okay. Then moving on to evaluating motor function, basically just looking at her eyebrows and her eyes and her mouth. Can you smile for me? Good. And frown. Show your teeth. Raise your eyebrows. Close your eyes really tight. Okay, and then puff your mouth out. There we go. Okay, good. So those cranial nerves are all intact. We'll move on to your ears. Just inspecting and palpating, looking at her ears for any redness, any drainage. They look normal. Just palpating for any type of pain or nodules. Any pain when I pull? Good. And then just checking for the same other ear. Any pain?
No.
Good. Okay. And then basically doing the whisper test. And so that would I'm gonna occlude your ear, and then I'm just gonna whisper a very simple word like apple or baseball, and have her repeat it if she can hear me.
Apple.
Good.
Baseball.
Good, good. So then we'll move on to her eyes. We're just gonna assess her pupils, her irises, her cornea, sclera, and all around. Really, first we'll look at, they are symmetrical. They are equal right now. Her eyebrows are nice and symmetrical, no signs of any abnormalities. Eyelashes are intact. Her conjunctiva are pink and no signs of drainage or infection. Her sclera is white, no yellow discoloration, which would be a sign of jaundice. I will assess her pupils for reaction to light by just shining the light in your eyes, making sure that they equally react, and measuring their size. They do equally react about to down a 2. Then assessing for accommodation, just asking, Shelby, I just want you to follow my finger, okay? Good. Okay. Then back to the center. Here, down, and back to the center. Now I'm just gonna bring my finger close to your nose. I want you just to follow it as far as you can. And she has good accommodation. Okay, we will then move on to basically inspecting her nose. Just kind of looking at it for symmetry, making sure there's not any signs of skin abnormalities, and there's not. And then palpating for any type of pain. Assessing for patency by asking Shelby to cover one of her nostrils and sniff, and cover the other nostril and sniff. Good, so they're very patent. Then basically assessing her maxillary and frontal sinuses by palpating and checking for any pressure or any pain. Any pain?
No.
Good. Okay, we will then move on to her mouth and throat. I'm gonna shine a light in your mouth, Shelby, just looking at her buccal mucosa, her tongue, her uvula, whether she has her tonsils still intact, and how her teeth look. stick your tongue out real good for me? There we go. Okay, just gonna look at your teeth. Alright, you can stick your tongue back in. Lift it up. Looking at her hard and soft palates. Her uvula in the back. Can you say ah? Good. And it moves the way it's supposed to. It is symmetrical, no redness. And her tonsils are still intact. We'll then basically move on to her neck. Looking at her trachea, assessing her thyroid gland. Her trachea is in the center. It is symmetrical. It has no inflammation. It should be a little bit uncomfortable, but it should not hurt. Any pain? Okay, and then just assessing her thyroid to make sure that it's not enlarged and it feels normal. Then moving on to test for her lymph nodes. And I'm just checking for any swelling, any bulging, any hardness, any palpable lymph nodes. She does not seem to have any that are enlarged. Okay, then I will inspect and palpate and auscultate her carotid pulses, one at a time. And they are strong. Now I'll then auscultate for fruit. And then we will move on to her chest and her posterior and lateral. So just turn around for you, Shelby. I'm just going to inspect and palpate her posterior chest. It is not symmetrical because she has scoliosis, so this right side is a little bit higher than the left. Palpating for any firmitus. I do not feel any present. And palpating for any nodules or pain or just overall abnormalities. And everything else seems normal. Her expansion is very good. I will also assess for the firmitus by asking her to say 99.
99.
And again?
99.
And again?
99.
And again?
99.
And you shouldn't really feel major vibrations, but you should feel at least a little bit. She does have good vibration. Then I will percuss over her different lung fields. Okay, and then I will also percuss over her costovertebral angle, just assessing for flank tenderness. Any tenderness?
No.
Okay, good. Then next we will move on to I will assess her breath sounds. Almost forgot. It's an important part. Deep breath. Okay. Okay, and that's just assessing for any adventitious breath sounds. Any coarse or wheezing or rails, and hers sound really normal. We'll move on to assessing her upper extremities. I'll just inspect and palpate her arms, and they look very normal, good coloration, no pain, bruises, no nodules, nothing of the abnormal finding. Okay, then I will palpate her radial, ulnar, and brachial pulses. Then assess her capillary refills, making sure they're less than 3 seconds, that she is getting adequate blood flow, and she is. Okay, then we'll assess her range of motion by asking Shelby to extend her arms back behind her head and then hyperextend them back. Good, good. And then we'll assess her range of motion with her elbows by asking you to extend and flex. Good. And then flex to resistance and extend to resistance. Good. She has good strength. We'll also ask her to adduct and abduct her arms. Good. Okay, and then we'll move on to her range of motion in her wrist. So we'll ask her to extend her wrist and flex them and then hyperextend. Good. Okay, and then we'll assess whether you can make a fist and fan your fingers out. Close your fingers together and then touch your thumb to each finger. Good, good, very good. We'll then move on to her cerebellar function by doing the finger to the nose test. If you can touch your pointer finger to your nose and on the other hand. Good, good. And then we'll test for the graphicenia sterignosis. Shelby, basically what I'm going to do is draw a letter on your hand with your eyes closed, and I want you to tell me what I draw, okay?
O.
Good.
L.
Good, okay. And then the second part of this test will be that I put a random object in your hand with your eyes closed, and I want you to try to tell me what that object is.
Pen.
Good.
Tape.
Good, good. So that that function is very well intact. We'll then move on to rating her biceps and triceps and how they react to the hammer. So I'm just going to tap on your arm and check your reflex. Good. 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 Okay, and those are all intact. We'll move on to her anterior chest. You can lay down for me. Okay, I'm just gonna inspect her chest for symmetry, make sure that it's rising and falling together, that she has no labored breathing, which she does not, that her patterns are normal, and then we'll move on to palpating the chest for any subacute air or anything like that. Her work of breathing seems very normal. We'll palpate for any for her PMI by basically just placing the palm of her hand over her aorta. I know that kind of doesn't feel comfortable. I'm sorry. And there's really no thrills. And then we'll auscultate her anterior lungs and then listen to her heart sounds, her aortic, pulmonic, tricuspid, and point of Erbs. Deep breath for me. Okay, then listen to her heart sounds. You don't have to take any more deep breaths. And then moving on to her abdomen. We'll inspect her abdomen first for her skin, the contour, the symmetry, basically if there's any visible peristalsis or pulsations, her umbilicus for contour or any hernias present. Her skin looks good. There's no abnormal findings. There's no pulsations present or peristalsis that I can see, but sometimes on your thin, underweight people that you are able to see some visible peristalsis or pulsations. There is no hernia present, and her umbilical area looks very symmetrical. We'll then auscultate the bowel sounds. And auscultating our aorta and renal arteries. discussion of all 4 quadrants, just making sure she has good resonance. Good, and then on to light palpation. I'm just assessing for any masses or any pain upon palpation. Any pain, Shelby?
No.
No, and then moving on to deep palpation. Again, assessing for any masses, and then maybe assessing deep palpation for her liver, making sure that it's not tender or enlarged. Any pain?
No.
Okay. Then we'll move on to the lower extremities. I'll first inspect and palpate her lower extremities for her skin, making sure that the coloration is good, there's not any bruising or skin tears, and if there are, to document my findings. Palpating for any abnormal feelings or any pain that Shelby might have. Let me know if you feel any pain. Then, of course, palpating her popliteal, posterior tibial, and dorsalis pedis pulses bilaterally. Okay, and they are all equal and normal. Then we'll test her range of motion by asking her range of motion of her hips and her legs by asking her to bring her legs to a 90 degree. Then to touch her knees to her chest, one at a time. Good. Then to lift her foot up and bring her knee out. Good. And then to abduct and abduct her legs. Good. We'll then test her ankle range of motion by asking her to dorsiflex and plantar flex. Good. Good. And then invert and expert your feet. Good. And then dorsiflex and plantar flex to resistance. So if you'll pull your feet towards me. Good. And then away. Good. So she has good range of motion with resistance. Then we will rate her Achilles, knee, and the Babinski reflex by using the Ambulhamber. But before you get up, I'm gonna check your Babinski while you're laying in the bed. Basically, Babinski, babies, when their feet are drawn across their toes, fan out. Adults should not do that. And she has no reaction. Okay, good. All right, Shelby. Good. Good. Just spread your leg over just a little bit. There you go. Good. Okay. We'll then move on to her cerebellar function by asking her to move her right shin down her left leg and then her left heel down her right shin. Good, and that function is intact. Then assessing the lower extremities by standing and having her walk on her heels and her toes. Okay. Assessing her muscle strength by asking her to hop on one foot then the other. Good. Good. Okay, and then we'll assess her cerebellar function by doing the Romberg test, which basically, Shelby, just put your hands by your side and your feet together. We're just gonna make sure she doesn't have any swaying. And then close your eyes for me. And no real swaying with that either. Okay, you can open your eyes. All right, and that's just for any just non-good balance. We'll move on to inspecting and palpating her spine. Her spine is normal throughout down here. Like I said earlier, she does have some scoliosis, so this right side does tend to deviate a little bit into the S shape. We'll now palpate for any pain. Any pain, Shelby?
No.
Okay, and then go down and touch your toes. We're just gonna assess her spine and making sure that she has good spinal range of motion. And though it does lean to the right, she seems to have no problem touching her toes. Then we'll ask her to stand up and bend side to side at the waist. Good. And then bend back and kind of shrug your shoulders to the side. Good, good. Okay. And that concludes the end of my physical assessment.